1.5 billion people are affected by a group of parasitic and bacterial infections known as neglected tropical diseases. Over the next decade, these can be completely controlled and eliminated. These diseases have been around for thousands of years, but now we're going to solve them. I'm Ellen Agler, CEO of the End Fund. These diseases are called neglected tropical diseases, but really they're diseases of neglected people. People that often don't have a political voice. It's not that they're the big killers in the world. Mostly they cause widespread disability. They include intestinal parasites, schistosomiasis, elephantiasis, blinding trachoma, and river blindness. In the case of blinding trachoma, the eyelashes start turning inward and scratch your cornea till you're irreversibly blind. With elephantiasis, there's parasites inside of your lymphatic system that can cause so much damage that your legs can swell to 10 times the size. The focus needs to be on not just helping people survive, but also thrive, making sure that no one gets left behind. The great thing is, for the 5 diseases that the End Fund works on, the medicines are identified and available. They're largely donated by a consortium of pharmaceutical companies that are donating $4.5 billion of medicines per year. You can receive treatment, and that can put these diseases at bay. That, combined with great prevention and education, can ensure that these diseases can be controlled and eliminated. When we first started working in Rwanda, in some villages and communities, over 80% of kids had active infections of intestinal worms and schistosomiasis. Recently, when we've gone back, it's down to almost 0. There's one particular school that we went to in Ruswero where I met with the principal, and he said, you can tell the kids are taller, they have more energy, they're able to focus more. And he sort of also said something funny like, they have more energy, which also means they're getting into more trouble. But I think that's the good kind of trouble that you want. Children were getting dewormed as part of school health and nutrition. Once or twice a year, they took medicines that were being donated, but they also had learned that they can't swim in this local lake that was by the school. They knew that's where these freshwater snails were that were carrying the parasite. So I think that the integration of prevention with treatment has really been critical. Every day I'm seeing tangible progress. 8 countries have already certified the elimination of blinding trachoma. 14 countries have certified the elimination of elephantiasis. We see country by country paying more attention to this issue, creating national plans, mobilizing hundreds of thousands of frontline health workers that are able to deliver both education and treatment. It's pretty incredible. You look back in history and see these diseases have been around since the time of Egyptian pharaohs. And to think now, in our generation, on our watch, we can end these diseases is incredibly inspiring and absolutely doable.